After embarking on a landmark effort to improve care and contain costs, officials at Regional One Health turned their attention to a small group of patients, just 25 in all, who are showing up at the emergency department an average of 85 times a year, or about once every 4 days. These patients, the most prolific users of the department, ran up individual costs that averaged 20 times more than those of the other 27,200 emergency room patients during a recent fiscal year. Though they represented less than 0.1% of all department patients, they accounted for nearly 2% of costs. Regional One officials didn't stop there. They also looked at the patients in the top 5% of department users and found that group was driving almost 1/4 of facility costs. More, Shelby County Eye's massive $300 million redevelopment of the med and healthcare parlance. These patients are known as super utilizers, people who make repeated trips to the emergency department often because of a combination of chronic medical or behavioral health problems and unmet social needs, such as safe, stable housing and access to nutritious food. Focus goes beyond costs for institutions like Regional One, which gets public funds to treat large numbers of uninsured patients and 10 care recipients at its main campus in the Memphis Medical District. The focus on super utilizers isn't just about costs, officials say. It's also about addressing the issues that propel people to the hospital and finding better, more efficient ways of treating them. By photo June 20, 2018. Susan Cooper, Senior Vice President and Chief Integration Officer at Regional One Health, inside of the Adams Pavilion building at Regional One Health in downtown. Photo, Brad Best. The commercial appeal. Most people don't wake up saying, "It's Thursday, I'm going to go out and overutilize services." They wake up and have a perceived need, said Susan Cooper, Senior Vice President and Chief Integration Officer for Regional One. A year ago, Regional One launched an initiative called One Health to better understand the trends and conditions that place patients in need of treatment. The effort is intended to find ways to improve services for the most vulnerable patients and, in the words of CEO Drive Reginald Co-op, would move them into more appropriate levels of care. It's funded through a 3-year, $1 million grant from the Assisi Foundation of Memphis, as well as contributions from local philanthropists. One Health connects super utilizers to resources through the program. Regional One officials have been working with scores of partner organizations that provide services ranging from transportation to housing to mental health care. They've created an online resource that connects patients with free or reduced cost services. By photo. Reginald Co-op, CEO of Regional One Health, is pictured at their new East Campus on Quince. Photo, Nikki Borgman. The commercial appeal. The local effort is similar to others around the country. As a 2013 report by the Robert Wood Johnson Foundation noted, the top 5% of Medicaid recipients drive more than 50% of total program spending, prompting providers in many regions of the U.S. to initiate programs with intensive outpatient management care for superutilizers. In Memphis, with its soaring poverty rate and chronic housing and food insecurity problems, the need is particularly acute, Cooper said. She cites the case of one local super utilizer, a man who became homeless last November after losing his job. Already ailing with diabetes, which left him with poor circulation, he suffered frostbite after sleeping in his car during cold weather. He later moved into a homeless shelter, which still didn't offer much stability. The biggest problem was, he just needed a safe place to stay, Cooper said. Diabetes is just one of the chronic problems burdening super users. Others have behavioral health conditions that have gone untreated, mistreated or undertreated, she said. Still others have conditions ranging from high blood pressure to asthma and other respiratory problems, some of which are traceable to poor housing quality. Fixing the revolving door, because home environments and lifestyles are the biggest drivers of a patient's health. A trip to the emergency room often doesn't do lasting good. If you make people better but then send them to a home that has the conditions that sent them here in the first place, then it's just a revolving door, Cooper said. Partner groups help fill a critical gap in a highly fragmented system, serving social needs that Regional One's medical staff can't address. So how do you know whether an illness warrants a visit to urgent care or a trip to the emergency room? They, doctors, are taught to diagnose and treat disease, Cooper said. They're not taught to diagnose and treat homelessness, or to diagnose and treat food insecurity. One of the groups working with Regional 1 through the program is Door of Hope, which helps find housing and other services for the homeless. Executive Director Portia Goodman sees a direct correlation between homelessness and overuse of hospital emergency departments. The emergency room is the refuge sometimes for the homeless, regardless of how minor the medical need, Goodman said. Securing housing for the homeless allows them to get food stamps to ensure regular meals, Goodman said. Eventually they're often able to find work. The Regional 1 effort is designed to provide the right care in the right time at the lowest cost for a group of patients often disenfranchised by the healthcare system, Cooper said. Some 44% of non-trauma patients in the emergency department are uninsured. People tend to blame or label these people, she said. A year into the program, Regional 1 has made a significant shift in directing super utilizers to more appropriate care and services, Cooper said. This is all about improving the health of our community, she added. Reach Tom Charlier at thomas.charlier@commercialappeal.com or 901-529-2572 and on Twitter at @thomasorcharlier. Read or share this story, https://memnid.ws/2yims.